Good evening. Ever wondered how the deadly 1918 Spanish flu pandemic impacted soldiers and civilians during and after World War I? The Spanish flu was one of the deadliest pandemics in history, affecting countries all over the world, with an impact similar to what we've seen with COVID-19. Just like today's pandemic, the Spanish flu spread rapidly across the globe, overwhelmed healthcare systems, and left profound societal and economic scars. Can you believe that this devastating virus didn't just change lives, it altered the course of history? We'll explore how this pandemic affected soldiers and civilians alike throughout the video. As World War I raged on, soldiers faced not only enemy forces, but also an invisible enemy, the Spanish flu. Can you imagine trying to fight a war while battling a deadly flu? The conditions in the trenches, damp, muddy, and crowded, were ideal for the virus to spread rapidly among troops already weakened by malnutrition and the stresses of war. The flu's second wave, starting in the fall of 1918, proved particularly lethal. Many soldiers, feverish and weak, struggled to fight on. Military hospitals, already strained by war casualties, were overwhelmed by the influx of flu patients. Medical staff worked tirelessly, often at great personal risk, to care for the sick. Can you believe the sacrifices made by these medical professionals to save lives amidst the chaos of war and pandemic? However, many soldiers succumbed to the flu, impacting military operations profoundly by reducing the effectiveness of troops and delaying or altering battle plans. The flu's impact on the war was significant in several ways. Large numbers of soldiers falling ill reduced combat effectiveness, affecting morale and operational capabilities. Outbreaks of the flu sometimes forced commanders to revise battle plans at critical moments, and delays in troop movements and reinforcements occurred due to widespread illness. Medical resources were diverted from combat injuries to flu patients, straining military healthcare systems. Returning soldiers inadvertently spread the virus further as they traveled home, accelerating its transmission among civilian populations. Public health measures such as quarantine and the closure of public spaces were implemented to curb the outbreak, but the virus continued to spread rapidly in cities and rural areas alike. In places like Philadelphia and San Francisco, hospitals became overwhelmed and public life ground to a halt as the flu exacted a devastating toll on communities.
The medical community, unprepared for the scale of the pandemic, struggled without effective vaccines or treatments. Can you believe that at that time, medical science was limited in its ability to combat such a virulent virus? Public health responses varied widely and were often hindered by limited understanding of how the virus spread. Economically, industries and agriculture were disrupted by widespread illness, compounding the challenges faced during and after the war. By the time the pandemic subsided in 1919, it had infected about a third of the world's population and claimed an estimated 50 million lives globally. Can you believe the staggering toll this virus took on humanity? Its legacy included advancements in global health cooperation, disease surveillance, and public health policies that would influence responses to future pandemics. Reflecting on this transformative period, we witness how the Spanish flu intersected with World War I to shape the 20th century. The resilience and courage of those who endured both conflicts remind us of the enduring strength of the human spirit in the face of unimaginable challenges. Families mourned lost loved ones, communities rebuilt, and the world slowly recovered from one of the deadliest pandemics in history. So, as we reflect on this historical backdrop, we recognize how the Spanish flu pandemic, much like today's COVID-19 crisis, reshaped societies and healthcare systems, leaving a lasting impact on global health policies and our collective memory. The dual burden of war and pandemic profoundly altered the lives of soldiers and civilians alike, highlighting the interconnectedness of global events and their enduring legacies.